Hi everyone, my name is Freddie Cocker and I'm the Media Officer here at Barts Health. I'm here to talk to you today because we are delighted to be announcing the launch of the Psychological Support Service, which will be on hand to help any staff who need it. The Psychological Support Service was funded by Barts Charity, so we are going to talk to you today about what it is, how it can help people and how you can access it. I'm joined today by Carla Croft, who is a consultant clinical psychologist at Barts Health and who was the lead in starting the service in the first place. Carla, how are you?
Hi, I'm good. I'm really busy at the moment with all the work related to the service, but it's creative and exciting. So yeah, I'm good.
So Carla, what is the main thing that you'd want staff to take away from this interview? And tell me just a little bit about the inspiration for setting the service up.
I think there are a few things actually, but just as you asked me that, what sprung to mind was just connection with other people. It's something that we've sort of all lost at some point in some way over the pandemic, and human connections are superpower. So just being a vehicle for that and a place that can help support people becoming connected again, I think is one of the things that springs to mind. There's been a lot of suffering as well, and I think psychology brings to that some models and some ways of thinking about healing from that. So I'm really excited to sit next to my colleagues and bring some of that to the table and sit with them through this difficult time. So those are the things that spring to mind.
You talked about this idea of compassionate holding. Can you just explain a little bit about what that is in relation to the service?
Yeah, so the concept of compassion and the use of compassion is really protective for people. And what we're hoping to do in the Trust is really kind of put our money where our mouth is and put compassion in action. And so sitting with people, supporting them without judgment, trying to help them to find the help that might be there for their suffering and sitting alongside them in that way, we know will protect them for the future and make sure that the psychological impact that we know that people have felt from this event isn't long term. It also connects with a body of literature around the way we work with trauma. And what we know is that, especially in the early months post-trauma, that sitting in compassionate spaces, being, held in that with that compassionate attitude, is very protective for people and can even be the early part of a trauma therapy. So it kind of relates to a psychology model of how to work with trauma as well. And so what I mean by that is helping people to just think about the impact of what they've been through on their nervous systems and how to regulate some of that, and how to also unpick some of the feelings of shame and those sorts of things. So that's the early part of kind of trauma therapy, and we do that with a kind of compassionate hat on, if that makes sense. So.
Tell me a little bit about how the service works now. What can staff expect to receive once their application is confirmed? You spoke about a few sessions which they're allowed to. Can you give a little bit more information about that?
Yeah, I mean, in a really practical sense, we have an inbox, and interestingly, there was always an inbox throughout the COVID year, the pandemic year, that redeployed psychologists sort of managed. We've taken that on and we've changed the name of it, but it's still there. And so we look at requests every week that come into that inbox for teams and groups and also one-to-ones. And in terms of the one-to-one work, we agree that we will definitely sit down with people for at least 3 sessions if that's what they want, and really just help them think about their needs, help to point them in the right direction in terms of community services and other services that might be available to them, and really do a nice broad kind of assessment, almost enhanced assessment of what people need and point them in the right direction. That's the way I see our role. We don't quite have the infrastructure to be doing the full course of therapy with people, but we want to make people feel that they're being held in with compassion and that they're being helped to find the help that they need.
It's really important, Carla, that everyone feels comfortable accessing this service. So not just clinical staff, but non-clinical staff, managers and everyone in between. Why is that so important?
I think that, first of all, at the heart of our service is an equitable sort of access. So we really want to everybody from all sites and from all bandings and all professional backgrounds to come forward. I think the pandemic has been a real leveler, hasn't it? You know, where we know that people in all sorts of roles have held this system together and been holding a lot, no matter what professional background. So we want to be there for everyone and kind of honour the role that everybody has played throughout the pandemic year and going forward as well in recovery and looking at what the system will look like going forward. So I hope that everybody will feel that we're accessible to them no matter what professional background.
For a lot of people, Carla, reaching out to the service might take a huge amount of courage and strength. Why is it important we stress the importance of reaching in as well to people who might not be able to do that?
So data is really clear that all of us who work in healthcare are really, really bad at self-care and asking for help. So I think we all have that in common, psychologists included. So we're very aware of that. So one of the things we thought about early on is two things actually. One is starting with outreach, starting with looking at need, reaching out to people, just having kind of scoping sessions with people to think about what need might be there so that we're not waiting for them to come forward to us all of the time. The other thing is the question of where we sit and where we keep notes and that sort of thing. And we're being very careful to keep everything we do confidential and out of kind of official systems so people feel that they can come forward and feel that they're in a safe space when they see us. So those are two things that kind of in terms of forming the service were very, very important to us because we know that data is there in terms of the way healthcare workers feel about coming forward. So,
as well as the service, Carla, every Barts Health staff member has the opportunity to have a compassionate conversation with their line manager or their staff member if they are the line manager themselves. How can staff approach having that?
Well, I think that we're putting in place quite a lot of information and training around that for managers, and that will carry on and we'll build on that. So we'll sit alongside managers as they start to kind of hone those skills and think about how to do it. I think most people will find that attending in that way isn't completely new to them, and we want to demystify it really, because it's just tuning in. It's doing something that comes naturally but that we miss out on sometimes in the NHS because we're so busy. So it's helping managers to really think about stopping and having a natural conversation, which is just about tuning in, asking how are you. There's been a phrase that's been going around during the pandemic, really, how are you? And we're asking managers to sit and do that and being really clear with them that it really requires mainly no distractions, carving the time out, and also at the heart of those conversations is really that managers feel they can ask those questions and be a pointer to help rather than feeling they have to provide the help. I think that's another barrier in the NHS when we're rushed. People don't want to ask that question, how are you, because they don't have time to kind of help you. And but we really want to impress upon managers that those conversations are about leading people to help or pointing to help. We also want to normalise this way of talking in the NHS. Now the pandemic has taught us a lot and helped us to grow. We want to make these conversations normal, so we want to invite people to have that big conversation every year with their managers, but also that in smaller ways throughout the normal working week that they're talking in these ways as well.
And as a final question, Carla, where can people find the psychological support service on WeShare, and are there any other links you can signpost them to?
We have a special link under the wellbeing section of WeShare that you'll find our Team Barts Health psychological support service link there. I've just been talking to my team actually about putting some writing there regularly, some helpful blogs, etc. So we want to make grow that space. But at the moment you will find everything you need to know about all of us clinicians and about our inbox and everything on that link. I would say that in terms of other resources, our closest partner organisation is Keeping Well Nell, which is an organisation that is available in the local area to all staff, social care and NHS actually. And I would say that their website is amazing for resources, for lots of self-help advice, and for an on-tap listening service as well. So that I think is a really good cache of sort of resources in that link. And we do work closely with them too. And there's a lot of trade between the two of us. So, yeah.
Carla Croft, thank you so much for talking to me today, and best of luck with the launch of the service.